was logged out for a short while. So I'll share uh, all right, thank you. Sorry, I'm having a bit of a network issue here. All right. If can you confirm if my screen is visible for everyone?
Yes, we can see your screen and we can hear you properly.
Thank you very much. So the topic of his presentation is strengthening public health preparedness to tackle emerging infectious diseases. So I'll go straight to. All right. So his first slide has information that continues from where Professor Iwale Tomori stopped, which is for us to recognize and value the role of nature in reducing systemic risk and mitigate the risk of future zoonotic disease outbreaks by addressing their root causes. At the end of the day, one of what this slides will establish is the fact that it is very imperative for us to approach public health preparedness through the One Health paradigm. So this slide is just to show what man-made activities have been able to do to nature, which is to create imbalance in nature, and this has led to emergence of emerging infectious disease outbreak, the wanton destruction of forests, the killing of animals for ornaments, bush burning, exploration, all are including all deliberate acts of aggression, environmental degradation, trade, illegal trade in wildlife, and so on and so forth. All of these have contributed largely to an imbalance in nature and have continued to enhance the possibility of having diseases from wildlife transmitted to human. So what is an EID, emerging infectious disease? This slide describes what an EID is, which it includes EIDs are caused by evolving and adapting strains of different diseases or spread to a new population. That is to say, they are either new or the emergence of previously suppressed infectious diseases to an area undergoing ecologic transformation. Of growing interest, according to this slide now, is the adverse synergistic reactions we are experiencing in emerging diseases, such as diseases like HIV, TB, and malnutrition, where you have one immunosuppressant for the other to take advantage of. So many emerging diseases are zoonotic. This has been established by previous slides. And then we have a number of such emerging infectious diseases listed in this slide, quite a lot of them. And then we see the ones in red from animals and the few that are in blue. So the intensity of EID is on the increase. Definitely, we have had quite a lot of outbreaks in the last decade. We've had issues like the measles, which infected over 200 million people. We had smallpox, which also infected over 300 million plus people. We had the Spanish flu, and presently we have COVID-19 and monkeypox. So this slide shows the frequency of EIDs and what states they are in. So we have measles, which started from the 7th century, and previously the status is that it is ended. We have smallpox also started 10,000 BC, and status is ended. We have cholera with a status of an ongoing outbreak. We have the Hong Kong flu, HIV/AIDS, which is also ongoing, COVID-19, which is the ongoing pandemic, started from 2019 till date, and monkeypox, which we started in 1948 and is still ongoing as of 2022. So what this is showing us is that we will continue to have outbreaks depending on how we want to manage them. COVID-19 for breakfast and monkeypox as branch. We've had, since COVID-19 outbreak started in 2019, we've had over 500 million global cases with over 6 million deaths worldwide. Presently, the total number of outbreaks of the recent monkeypox stands at 1,300 global cases with about 58 deaths worldwide. Now, straight to the topic of discussion proper. What are the factors to consider in anticipating and managing emerging infectious diseases? And this is also the things that were deployed by Lagos in management of first COVID-19, now cholera and monkeypox. One is to anticipate the scale of impact. So in anticipating the scale of impact, it is sitting down to do an analysis of what to expect should there be an outbreak, worst case scenario. Also, the transmissibility of the pathogen, to have an understanding of the mode and speed of transmission with view towards planning to mitigate the transmission of this pathogen. Another factor for consideration is the capacity of health system. It is important for each state or each planning authority to be able to have a good understanding of what their system can take, so as to be able to make a forecast on what they need, on what their strengths are and what their weaknesses are. So they are able to make a forecast on how they intend to deal with the outbreak with different case scenario. And then the last of this factor is severity of outcome. Every system needs to be able to define the potential severity of the outcomes on different population groups. What will be the impact of monkeypox on the youth? What will be the impact of monkeypox on the poor? What will be the impact of monkeypox, for instance, on the rich, and so on and so forth? And by being able to evaluate the severity of this outcome, appropriate plannings will now be put in place to mitigate the spread. So how does Lagos tackle emerging infectious disease? Lagos State finds a way to convert a vicious cycle into a virtuous one. How? One is biological catastrophe, EID induced. They are studied worldwide. We started the study from that of Ebola. And from the lessons learned from Ebola, Lagos finds a way to alleviate public health crisis by building systems whereby Lagos is able to identify the need in the different case scenarios that is presented per study. And then alleviate economic crisis, economic recovery, and resilience. Part of what Lagos deploys, for instance, is to alleviate economic crisis by giving some subsidy to treatments. For instance, in the case of COVID-19, monkeypox, or any of these outbreak treatments in Lagos State is free. Provision of isolation center for people who are infected or people who show clinical symptoms. Delivery of the care pack for people who are mildly symptomatic in the case of COVID-19, and for people who are severely symptomatic, giving them free treatment at government facility. Solidify legislative and governance framework. What Lagos has done in the last 5-6 years after COVID-19 was to ensure that there is enough legislative framework to build the response on. Lagos has the biosecurity policy and guideline, which is a list of how they intend to tackle emerging infectious disease whenever there is an outbreak. Leapfrog investments in the health sector, leveraging the public health crisis to gain political will. This was one of the things that informed the onboarding of private laboratories in the course of COVID-19 testing from Lagos, which was eventually adopted by the national. Then last is building a resilient health system that is ready for future outbreak. This rests on the decision by Lagos after the Ebola crisis in 2016 that never will Lagos be caught unawares again. And what they have done is to constitute a body of first responders that are trained annually on how to be able to respond in the laboratory and outside the laboratory. And they are classified as the core membership of the Lagos State Biobank. So this is just a timeline of what Lagos has done in the course of responding to EID. In 2015, shortly after the Ebola outbreak, Lagos constructed the biosafety level 3 laboratory and was able to secure commitment from partners to build one. And by 2018, staff training as well as the commissioning of the Lagos State Biobank was done. Within 2018 and 2019, the Lagos policy and guideline was built, which is the legislative framework upon which Lagos emergency preparedness response is built, was commissioned and was drawn, and it was presented to the government and adopted by the Lagos State government as 2019 policy and guideline for for public health emergency response. By 2019 also, a Lagos State Governance Council was established, which is a council that governs sample utilization, sample collection, as well as data that accrues from sample usage. And this governance council was very, very strategic in the course of the pandemic. Between 2018 and 2022, presently and beyond 2024, what Lagos is doing now is to upgrade and expand the isolation capacity of IDH, to also commence plans to build the Infectious Disease Research Institute, which is also going to be situated in IDH here in Yaba, as well as the building of a BSL-4 laboratory, which is an attempt to ensure that should we have a pathogen X that requires a BSL-4, that's a biosafety laboratory for capacity to be handled, Lagos is in a position to handle such. Therefore, these are the things Lagos has been doing to ensure that Lagos is ready for any health preparedness. Instructively, it is the same thing Lagos has been selling to sister states across Nigeria to ensure that Lagos recognizes the fact that it's not isolated in Nigeria. And in conjunction with NCDC, Lagos has been working and in the realm of advocacy to make sure that it is not just only Lagos that is carrying on such activities like this, that other states too, it is important for them to carry on. They might not do as much as what Lagos is doing, but it is important for every state of the Federation to have a plan for public health preparedness. So a little about monkeypox, and so much has been said about monkeypox, but just to mention that it is a rare disease that is caused by infection with monkeypox virus. And furthermore, the causative organism, orthopox virus, mode of transmission is a zoonotic. That is to say, it is a virus that is transmitted from animal to human. There's possibility, and of course, it's been established that it can also be transmitted from human to human in the present outbreak that's been monitored globally. The animal reservoir are rodents, and the first isolation was done in 1948, not 1958. So this is just a list of countries where we have monkeypox has been identified, or presently we have 22 countries from Europe, 1 from Asia, 5 countries from the Americas, and 3 from the Middle East. This is a graph of the monkeypox outbreak per year from 2017 to 2022, with the highest outbreak in Lagos State recorded in 2019. 2022 is still ongoing, but so far we've had 5 individuals identified with monkeypox in Lagos State. So this is just a graphic, the skin lesion you see in case of monkeypox as was recorded in Lagos State. So measures deployed by Lagos State to prevent the spread of monkeypox. To anticipate and learn, Lagos is studying the scale and impact of monkeypox in other regions. Models are being made on potential impact on Lagos to support policy decision making. Capacity is being built. Part of what Lagos is doing right now is the validation of the use of LSB. And the present setup involves sending samples to the National Reference Laboratory in Abuja for identification. However, part of what Lagos is doing right now is to build capacity for the state laboratory, as is the Lagos State Biobank, to be able to detect and sequence positive cases of monkeypox. The validation is presently ongoing. Also strengthen the capacity to the health system to contain cases. I know that in Lagos State, Lagos has convened almost 5 meetings to study the potential impact and what needs to be done between the laboratory and the case management officers, that is IDH. Lagos is also initiating appropriate policies, support policy making process, 100% admission of positive cases. Even as of 2 days ago, there was still a meeting with the personnel of mainland hospital, that's IDH, to ensure that every positive case in Lagos State is admitted until there is even if it is not symptomatic, for as long as it has lesion and it is positive using with the RT-PCR, should be admitted until we are sure that the person is negative. Initial a robust contact tracing program early. Of course, that has started too. Lagos is working with the Summers team from Abuja, from NCDC, to ensure that contact tracing is robust and we're able to identify all in contact and test all of them. In the course of this, several samples have been collected and tested. And mitigate spread and deploy public and private resources through a central planning approach and release of monkeypox protocols for population education and management. Lastly, this is admitting to the fact that the best way to approach such outbreaks or emerging infectious disease is the One Health approach. It is very, very essential to coordinate, to communicate, and to collaborate with every member of the chain in order to ensure that people are well informed, people are able to identify, and people are able to react appropriately to any case of emerging infectious disease. The best policies that will protect the health system is to recognize and value the role of nature in reducing systemic risk and mitigate the risk of future zoonotic disease outbreaks by addressing their root causes. One Health recognizes the interconnectivity between man, animals, plants, and their shared environments. Thank you. So this is the end of